and that class is how eating healthy and exercising daily will improve your health. Do you have any questions? Mr. Heisenberg, does that mean that if we do these two things, we'll stay healthy forever? Well, not exactly, Tommy. What we do in our day-to-day lives surely does have an impact on our overall health and well-being. But there are many other important factors that also determine our health outcomes long-term. Like what, Mr. H? Well, let's start from the top. There are three main categories that all determinants of our health fall under: upstream, midstream, and downstream. For instance, if you fall off your bike and break your leg, that is an example of a downstream health problem. These are health outcomes that are usually caused by personal behavior and are also known as proximate causes of disease. Okay, so then what are midstream and upstream factors, Mr. H? Midstream factors occur at the community level. Let's say that when you fell off your bike, you're on your way to school, and you had to ride your bike to get there because your family can't afford a car, and your neighborhood doesn't offer a safe and efficient school bus service. These are both examples of midstream risk factors occurring at the community level, and both of which played a role in you falling off your bike. So, the upstream factors must be... At the upstream level, we can see how federal policies and societal norms affect our health outcomes. After falling off your bike, your leg looks swollen and is obviously broken. Surely you should call 911, right? However, let's say that your family also doesn't have sufficient funds to afford out-of-pocket health bills. If that's the case, then you are much less likely to call an ambulance and receive professional health care. This is due to the lack of socialized health insurance in the United States, and the result is many impoverished families not getting the care that they need. This is an example of an upstream health factor, also known as a distal cause of disease. Okay, this is all starting to make sense, but I'm still a bit confused. What other factors fall under the upstream level? There are many more examples of upstream health factors. Let's consider racial inequality, for instance. Racial inequality has existed in the United States for hundreds of years, and the emergency room is no exception to this fact. For example, studies have shown that black patients are half as likely as their white counterparts to receive pain medication in the ER, which is partly due to a lack of diversity in the field of medicine in general. Some patients don't receive proper care simply because of their ethnicity, which can cause health problems later on in life. As such, racism is an example of a distal cause of disease for numerous Americans. Wow, I never thought of that. What else is considered an upstream factor? Well, class is ending soon, so I'll discuss one more example. Socioeconomic status also has a huge impact on your health. For instance, many poor families are forced to live in areas with lots of crime and poor air quality. Exposure to such negative surroundings as a child can drastically affect one's development and cause health problems into adulthood. These can range from developing lung cancer later in life all the way to developing post-traumatic stress disorder, also known as PTSD. Had the child grown up in a safer and more affluent environment, these disorders may not have occurred later on in life. That's why socioeconomic status is one of the most influential distal causes of disease. Wow, that's amazing. I never even considered how things that we don't even think about can have such a big impact on our lives. But I just have one more question. Is there anything we can do to improve our health outcomes? Outstanding question, and the answer is yes. While you kids are too young to vote, one day you will have that right. And in order to change upstream factors like economic inequality, we must enact change from the ground up, and you can start this by supporting groups and politicians who are committed to this cause. If people can access better quality of care and afford to lead healthier, happier lives, the negative effects of upstream factors will be mitigated. But change can only happen with you, the next generation, and that starts with you guys getting involved. But guess what? I believe in you. Thanks, Mr. H.